ADHD, that's what we're talking about today. In my opinion, it is one of the most poorly managed conditions in the entire world, mostly the United States, because that's where the highest numbers of ADHD are, and the highest numbers of medications in use are for ADHD. What is the approach that is typically taken? It's typically a chemical approach. Try this medication. If this doesn't work, we'll try another one. If that doesn't work, maybe we'll try two. The point is it's all guesswork. What works for one doesn't work for others, so we keep guessing until we find something. If we don't find something, we'll take two and we'll add it to that. If that works for a while, then we'll just increase the dose when it stops working. Never mind that we still haven't found out why do you have ADHD in the first place. What's the cause of the ADHD? So as functional medicine doctors, that's what we do. We solve the puzzle. Before we get into more of that, I'm Dr. J. I've been in practice for over 25 years to help thousands of people with ADHD, adults and kids. And our protocol works. It's got a high success rate. It is easy to follow, and it works for almost everybody that we've had in our practice. So how do we solve that? We start looking at the cell level. We look at testing. We look at your diet. We look at your lifestyle. We look at all of those things. But the biggest thing to note is that we start from the cell on up. Cells form tissues, tissues form organs. Organs control the body. If the cell is not working, that means the tissues aren't working, that means the organs aren't working. Our goal is to free up the cell to be able to do what it needs to do it efficiently, and that's our first step. With ADHD, sometimes it's neurotransmitters as well, and those are the things that help the signals get from the brain to the other tissues or within the brain to different parts of the brain. So we can test neurotransmitters as well. And there's a couple that are very common to be low or not present almost at all in ADHD kids and adults. So we can test for those. The biggest thing that I can tell you is our protocols work, they have high success rate, and they've worked on thousands and thousands of adults and kids. So what I want you to do, I want you to solve your ADHD. I want you to find the cause of your ADHD. So what you're going to do now is you're going to go right below. You're going to click on the schedule a discovery call. All a discovery call is a time for you and I to ask each other questions to see if our protocol will work for you, to see if it works in your lifestyle. And if it does, then we'll get started right away. Each person that comes into our office that becomes a patient, we have a map for. We create a map for each individual to show where we're starting, where we're going, and what we're going to do to get there. That way you understand the entire process. Transparency is a big deal in your healthcare, especially when you're changing a lot of lifestyle factors. So again, click the button below, click to schedule. All you do is choose a date, choose a time. I'll call you. Here's what it is not. It is not a sales call. I'm full most of the day with calls of people just like you. I don't want to do a sales call. I hate them. You hate them. We'll just say we both hate them. So let's go ahead and schedule a time that we can talk, get to know each other, and use our highly successful protocol that's worked for thousands of others. Click below, schedule a time that works for you and a date that works for you. I'll call you at that time. We'll ask each other some questions, have a great conversation to get to know each other, and see what our next step is from there. I thank you so much for your time for watching. This is Dr. J for the Health Revolution Clinic.